Okay, so how do we treat MS in conventional medicine? We generally use radiology to determine what's going on in the brain and the central nervous system, and then we give medications. And this is actually a very good approach. There's nothing wrong with using medications. I'm a physician, I'm not anti-medications, and I think there's a time and place for medications because MS hits people when they are young, and we need to protect their brains and spinal cord so that they can have good quality of life throughout their life. And this is a very different era of MS care where we actually have access to maybe 20 or so medications. So pharmaceutical strategies may include binding a receptor on a T cell. Okay, so every cell in the body, most cells in the body put out receptors. Think of a receptor as an arm that's sticking out with a hand, and the hand is trying to feel for what's out in the environment. And if something, a molecular shape comes by that matches it, it might grab it. And once it grabs that shape or that molecule, that receptor can turn on or off. And as a result, something will happen in the cell. It sends a signal into the cell. So some drugs bind a receptor on T cells and block it and prevent that T cell from getting into the central nervous system to cause damage. Other drugs can bind those B cells that have gone rogue and destroy them so that they can't get into the central nervous system to create antibodies and attack myelin. Other drugs may actually suppress the inflammatory response by decreasing the T cells that may produce cytokines that are inflammatory. Cytokines are just molecular messengers used by the immune system to communicate. And so if you can suppress the cells that make these cytokines, you can lower inflammation. Another approach that pharmaceutical companies have tried out is that they activate really good pathways like the NRF2 pathway that increases our antioxidant molecules. And antioxidants are important because they surround our cells and protect our cells. Just as a normal part of our metabolism, we produce damaging molecules like through the process of digestion, and that can lead to damage to our cells. So if we have antioxidants, we can neutralize those damaging reactive oxygen species. Okay. Now, many other unwanted things, bad things like toxins can also increase reactive oxygen species. And so if we have antioxidants around, we can neutralize them. And the end effect of turning on this NRF2 pathway is that you also lower inflammation. These are just 4 examples on how some DMTs work, and they are all reasonable approaches. But one thing to notice here is that each drug has its own pathway that it turns on or off. It's not doing this broad activation of many things in the body. It's mainly just focused on one pathway. That's how we develop pharmaceuticals. And pharmaceuticals have potent effects. If you took a medication and it didn't do anything, you probably wouldn't use it. So drugs are purposely designed to be potent. But let's think about something a little different. What activates B and T cells in the first place? We have to think about why these B and T cells went rogue and started doing things that we didn't want them to do. I want you to start thinking upstream, okay? And by upstream, I mean, what came first? What came before, right? What were some of the factors that made these B and T cells become uncooperative, right?